Hello and welcome. Today we're diving into a rare but serious autoimmune disorder affecting the kidneys and lungs, Goodpasture syndrome, also known as anti-GBM disease. Join us as we explore its causes, symptoms, diagnosis, treatment, and more, providing a comprehensive overview of this complex condition. The exact cause of Goodpasture syndrome remains somewhat mysterious, but it's understood to be an autoimmune disorder. This means the body's immune system, which normally protects against foreign invaders, mistakenly attacks its own tissues. In Goodpasture syndrome, the immune system produces antibodies that target a specific protein called the alpha-3 chain of type IV collagen. This protein is a crucial component of the basement membranes in the kidneys, specifically the glomeruli, and the lungs, especially the alveolar walls. Now let's delve into the pathophysiology. When these anti-GBM antibodies bind to the basement membranes of the glomeruli in the kidneys and the alveoli in the lungs, they trigger an inflammatory response. In the kidneys, this inflammation leads to glomerulonephritis, damaging the filtering units and impairing their ability to remove waste and excess fluid from the blood. In the lungs, inflammation results in alveolar damage, causing bleeding into the air sacs, a condition known as pulmonary hemorrhage. This ultimately compromises the lungs' ability to perform gas exchange, leading to respiratory distress. The severity of these processes determines the extent of kidney and lung damage. Goodpasture syndrome is considered a rare disease. Its exact prevalence is difficult to determine, but estimates suggest it affects around 1 in a million people. It can occur at any age, but there are two peak age ranges. The first is between the ages of 20 and 30, and the second is between the ages of 60 and 70. Men are slightly more likely to be affected than women. While there is no known geographic predisposition, certain genetic factors and environmental triggers may increase the risk. The signs and symptoms of Goodpasture syndrome can vary depending on the organs primarily affected and the severity of the disease. Early symptoms might be vague and include fatigue, weakness, nausea, and weight loss. As the disease progresses, kidney involvement may lead to blood in the urine, foamy urine sign indicating protein leakage, swelling in the legs and ankles, and high blood pressure. Lung involvement typically manifests as shortness of breath, coughing up blood, chest pain, and a general feeling of being unwell. In severe cases, respiratory failure can occur. The combination of kidney and lung symptoms should raise suspicion for Goodpasture syndrome. Diagnosing Goodpasture syndrome requires a combination of clinical evaluation and specific laboratory tests. A crucial test is the detection of anti-GBM antibodies in the blood using techniques like ELISA. A kidney biopsy is often performed to examine the glomerular basement membranes under a microscope and confirm the presence of antibody deposits. A lung biopsy can also be performed, though it's less common. Other tests, such as urine analysis to check for blood and protein, and chest X-rays or CT scans to assess lung involvement, are also important in establishing the diagnosis and assessing the extent of organ damage. While Goodpasture syndrome is primarily classified as one entity, anti-GBM disease, it's important to distinguish it from other conditions that might cause similar symptoms. Occasionally, anti-GBM antibodies may be present alongside other types of antibodies, such as antineutrophil cytoplasmic antibodies, NNCA. This overlap syndrome can present a diagnostic challenge and may influence treatment strategies. Therefore, a thorough immunological workup is essential for accurate classification. The treatment of Goodpasture syndrome aims to suppress the immune system and remove the harmful anti-GBM antibodies. Plasma exchange, also known as plasmapheresis, is a key therapy used to filter the antibodies from the blood. Immunosuppressive drugs, such as corticosteroid prednisone like prednisone cyclophosphamide, are used to dampen the immune system's attack on the kidneys and lungs. Supportive care, including dialysis for kidney failure and oxygen therapy for respiratory distress, is also crucial. Early and aggressive treatment is vital to minimize organ damage and improve outcomes. Unfortunately, there's no known way to definitively prevent Goodpasture syndrome, given its autoimmune nature and the lack of a clearly defined trigger in most cases. However, avoiding potential environmental triggers, such as exposure to certain solvents or hydrocarbons, and promptly addressing any respiratory infections might potentially reduce the risk. Smoking is a known risk factor, and smoking cessation is strongly recommended. Ultimately, early diagnosis and treatment remain the most effective strategies for managing the disease and preventing severe complications. The prognosis for Goodpasture syndrome varies depending on the severity of the disease at diagnosis and the promptness of treatment. With aggressive therapy, including plasma exchange and immunosuppression, many patients can achieve remission and preserve kidney function. However, some individuals may experience irreversible kidney damage and require long-term dialysis or kidney transplantation. The presence of severe pulmonary hemorrhage at diagnosis is associated with a poorer prognosis. Recent research is focused on developing more targeted immunosuppressive therapies with fewer side effects and identifying potential biomarkers for early diagnosis and disease monitoring. Studies are also exploring the role of genetic factors and environmental influences in the pathogenesis of Goodpasture syndrome, paving the way for potentially novel preventive strategies in the future.